Doing very good, thank you. Just cold. Didn't think I would be wearing this in the middle of September. How are you doing, Octavia?
I actually mentioned to everybody that I'm joining from the Eastern Cape. It's quite chilly on our side as well. But it's surprising that the weather is the way it is, but also the reality of climate change during this time and seeing it in front of our eyes.
Yes, I think it shows us that there are weird things to come that we need to prepare for and try to prevent us spilling over the edge where we can't get back from climate change.
No, that's true. Doc, once again, thank you so much. So September is Rabies Awareness Month. We actually had a conversation yesterday. So for those who don't know, that we have a podcast called Farmers Inside Tech, and Dr. Alicia Klitter was having a conversation with me yesterday on a specific topic. So please join, listen to that conversation over there as well, and follow us on Farmers Inside Tech. So before we kick it off, I'd like to maybe just say that it's such a privilege to speak to you. Some of the farmers that are joining us are quite excited to have you here as well. So I'm quite excited to hear if they have any questions for you. But as we are getting that, maybe Doc, if you could just explain to us what exactly is rabies, how is it transmitted, and what are some of the common symptoms?
Okay, so rabies is caused by a virus, a Lissa virus, and it's able to infect basically any mammal species, and this includes humans as well. So what this virus does is it infects the brain of its host, and this leads to behavioral abnormalities, disturbing neurological signs, and eventually leads to death as well. This is one of the most deadly diseases known to man, because once you start showing clinical symptoms, there's no cure available, and unfortunately an animal or human with rabies will die. But the good news about this disease is that we are fully able to prevent it, and we mainly do this through the vaccination of dogs and cats and other animals, and also through providing post-exposure prophylaxis to humans that have been exposed to rabid animals. So how this disease is transmitted, the virus is shed in the saliva. So if an infected animal like a dog or a jackal or mongoose attacks and, let's say, bites, scratches or licks another animal or human being, and that saliva either enters a wound or through your mucous membranes, the virus enters your body, it travels through the neurons to the brain, and your brain gets infected. This can take several days, several weeks to several months to happen. So there's often quite a long incubation period between contact and getting infected and before you start showing clinical signs. So basically, if I just summarize the typical signs that you'll see regarding rabies in animals, because it infects the brain, you'll see a change in behavior. You'll see animals that are usually tame, like your pets, become aggressive, and your wild animals can also become overly aggressive, or they can become tame and start approaching humans. And that's usually the danger zone when humans approach this animal that has become tame, and then they get attacked. You'll also see excess saliva that's dripping or foaming from an animal's mouth, and sometimes it looks like they can't swallow properly or like they've got something stuck in their throat. They may also vocalize continuously and make strange noises, and as the disease progresses, they may become wobbly and eventually they become paralyzed and die.